You've probably heard the term evidence-based policy a million times. And it sounds fantastic, doesn't it? I mean, use science, use data, make smarter decisions. It's an incredibly compelling idea. But what if the way we think about good evidence is actually a trap, especially when we're talking about our biggest social problems? Let's get into it.
So that brings us to the big question, right? What really makes evidence good enough to build, say, a huge public policy around? Is it a perfect airtight experiment? Is it a powerful story? Well, for a long, long time, the experts had what they thought was a really simple, really clear answer. And that answer was a ladder. Yep, a ladder. A straightforward, easy-to-grasp hierarchy of evidence. The idea was super simple. If you want to find the best, most trustworthy proof for something, all you have to do is climb to the very top rung. Now, this model was actually borrowed straight from medicine, and it lays out a really clear ranking. At the very, very top, the quote-unquote gold standard, you have randomized controlled trials, or RCTs. Then, a few rungs down, you've got things like observational studies. And way, way down at the bottom, stuff like expert opinions and anecdotes. The message here was crystal clear. The higher you go on this ladder, the better, the more pure the evidence is.
And look, this system is fantastic if you're a doctor trying to figure out which of two pills works better for a patient. It's objective, it's clear. But here's the million-dollar question. What happens when you take that exact same ladder and try to use it to decide on a really complex social policy, like how to tackle poverty or overhaul an education system?
And this is where you really see the fundamental mismatch. In medicine, the focus is pretty narrow. Does this treatment have a specific clinical effect on a person? The question is simple. Does it work? But public policy, that's a whole different beast. It's got to juggle social factors, economic realities, political battles. The question isn't just, does it work? It's, will it work here, for us? And by the way, is it even socially acceptable? That's a much, much messier conversation.
So, if we're saying this ladder might be the wrong tool for the job, we really need to dig into why. And it turns out this simple hierarchy has three big hidden flaws that pop up the second you take it out of the tidy world of the clinic and into the messy real world. Let's break them down.
Okay, so flaw number one comes to us from the world of political science, and it's a huge one. Making policy is never, ever just about finding a single clinically correct answer.
At its heart, policy is all about a tug of war between different values. We're not just trying to say lower a mortality rate. We also care deeply about things like fairness, individual freedom, and whether a new law is something the public can even stomach. So when we insist that only RCT evidence, that top rung, is what matters, we're not being neutral. We're actually making a hidden political choice that those clinical outcomes are more important than everything else. And this obsession also kind of pushes us to ignore the biggest, gnarliest problems, like all the social things that make us sick, precisely because they're too messy to fit into a neat little experiment.
Now, the second flaw is a little more philosophical, and it all comes down to one word: context. Just because an experiment proves something worked great in one specific place, under very specific conditions, doesn't mean it's going to work for you. You see, this is the classic difference between internal and external validity. An RCT is a champion of internal validity. It can prove beyond a doubt that the intervention caused the result in that trial. But it tells you almost nothing about external validity, whether it will work anywhere else. A new drug usually works pretty much the same way in people in different cities because our basic biochemistry is universal. But human behavior, social systems, culture, no way. Those are wildly different from one place to the next. You can even end up in a ridiculous situation where a meta-analysis averages out a study where something worked great with another where it was a total disaster, and it spits out this completely misleading conclusion of no effect.
The philosopher of science Nancy Cartwright just hits the nail on the head here. She says that for real-world policy, we don't need to know that it works somewhere. We need evidence for it will work for us. And that is a fundamentally different question that needs a fundamentally different kind of proof.
And that brings us to our third and final flaw, which comes from sociology. Now, this one's a little more subtle, but it is incredibly powerful. The very act of measuring a problem isn't a neutral scientific thing. It's a social choice, and it shapes everything that comes after.
We all kind of know this, right? Our health isn't just about biology. It's deeply connected to social things like our income, our gender, where we live. But if you're obsessed with only using evidence from RCTs, you can start to ignore these massive structural issues just because they're too hard to experiment on.
And what's more, the very labels we use in our studies, how we define poverty or how we categorize race, those aren't objective facts of nature, they're social choices. And depending on what definitions we pick, we might be steered towards certain solutions, while other, maybe better, solutions become totally invisible.
Okay, so if this evidence ladder we've been using is wobbly, if it's misleading, if it's just fundamentally broken for making these big, tough policy choices, what's the alternative? Do we just throw our hands up and give up on evidence? No, of course not. We just need a much better metaphor.
The way forward starts by realizing we have to stop trying to force every single problem up the same rickety, one-size-fits-all ladder.
And instead, we need to start thinking about evidence as a toolbox. I mean, you wouldn't use a hammer to saw a piece of wood, right? The goal isn't to find the one best tool in the world, it's about choosing the right tool for the specific job you're trying to do.
And this leads us to this really powerful guiding principle, the idea of appropriate evidence. It's a simple but profound concept that just says the type of evidence you use has to match the type of policy question you're asking. It's about picking the right tool for the job.
Let's look at what this toolbox approach actually looks like. So, if your question is this program clinically effective? Then yeah, absolutely, an RCT is the perfect tool for that, and you're going to judge its quality on things like bias control. But if your question is this new policy going to be publicly acceptable? You need a totally different tool, like survey research, and you'll judge that by its sampling methods. And what if you need to understand the cultural context? Well, then the right tool is probably an ethnographic study, which you judge on completely different standards. Every tool has its purpose, and every tool is judged on its own terms.
So this whole new approach, it really frees us from the tyranny of that single ladder, and it empowers us to start thinking way more critically. So how do we actually put this into practice? Well, it all starts by asking a much better set of questions.
Here are 3 questions you can ask anytime you're presented with evidence for a policy. First, what are all the things we're worried about here? Not just does it work, but is it fair? Is it affordable? Is it the right thing to do? Second, do we actually have a good reason to believe this evidence, which probably came from somewhere else, is going to apply to our specific community with our unique context? And third, are we defining the problem and the people involved in a way that actually helps us, or are we just using neat and tidy categories that miss the point?
So, if you take away just one thing from all this, let it be this. The search for good evidence isn't about blindly trying to climb a single rigid ladder. It's about thoughtfully and intelligently opening up the entire toolbox to build better, smarter, and more humane policy.
And that leaves us with one final thought to chew on. Just imagine the difference it could make. What if our leaders stopped looking for that one single right answer at the top of a ladder and instead learned how to use the whole toolbox? Thanks for joining this explainer.